Hello, my name is Carolyn Boone. I'm a pre-kidney transplant coordinator at Duke Medical Center in Durham, North Carolina, and I've been a pre-transplant coordinator for about 23 years. So today, I'm going to talk to you about COVID standstill, telehealth, and kidney evaluation. This is a description of one center's response to COVID shutdown of clinic operations and in-person kidney evaluations. We started evaluation of new kidney evaluations by distance telehealth in April of 2020 with Zoom education classes and providers using telehealth and video to evaluate new patients. Our listed patients are normally seen annually to assess for their fitness to remain active on the kidney transplant wait list. So we started initially with Zoom and a video evaluation of new patients. Zoom classes conducted by transplant coordinators and medical providers did the video visits. Ancillary providers such as social work and financial coordinators and nutrition did telephone evals. It was difficult to ascertain the retention of material. Also, some patients were unable to connect or had much difficulty accessing telehealth. Consents were sent to patients but took months to be returned and required a long, involved telephone encounter to get consent signed. Medical providers were unable to perform physical exam and could not gauge the BMI or the mobility of the patient. This would require a later in-person visit before they could be listed. Lab work was not completed either. Our center requires one ABL to be done at our center, so patients had to come in for lab work. We also changed to in-person in June of 2020 as we were unable to accurately assess patients' physical status. In-person clinic visits instituted with the patient accompanied by one caregiver with a full PPE in effect. Patient in the clinic room with one caregiver in the room with the patient. The Zoom class was conducted by the transplant coordinator in each room via computer. Telephone calls were made to patients by finance, social work, and nutrition. In-person evals by medical providers, nephrology, and surgery. And then lab work was completed. We alternate our annual visits virtually and in person. Annual patients see in person with physician and video with social work and finance and nutrition. The advantage of the in-person visits allows the patients to have transportation knowledge of how to arrive to our center when called for an organ offer, ability to ask questions, and interact with transplant team members. So what we kind of learned from this was that we had better team satisfaction with our physicians being able to gauge our patient's medical condition and then to decide if they were a medical candidate. Our lab work was completed and transplant coordinators got consent signed and they were able to meet their patients. And telehealth does have a place, but should be tempered with in-person visits with a goal towards doing the best for the patients. And I just want to have a special thanks to my transplant team co-workers. Thank you.